Okay, so clicking hip or snapping or clunking hip is really common. Okay, and often there's a couple of issues. It can be that you've got a lot of tension and restriction in the front of the hip and the hip flexor, so it needs stretching and opening. It might be that you lack some pelvic stability, so your core can't switch on, so you overwork some of the hip muscles and the flexor muscles. Or it could also be that you lack a little bit of strength through the hip flexors, so you're not getting that same control, so then that hip can snap. Sometimes it can be both sides. Often one side is worse than the other. And one of the really common movements that we hear or feel the clunk is when we're doing work where we bring the foot to the floor, and specifically when we stretch and extend the hip and then bring it back up. Okay, so I'm going to show you a couple of different stretches, releases and strengthening exercises to try and help this problem. So the first thing is a hip flexor stretch. Now your normal hip flexor stretch is good. Okay, through here, where you tuck and you lean, but you really focus on tucking under. So we see that my back is arched a little and then I tuck under and feel that stretch. And if you want to add the arm, you can. Now you should hold this for at least 30 seconds and repeat 3 times, and do both sides, even if one side is the problem. Okay, now a nice way to get an extra stretch in the hip as you're doing this is to use a band, so one of your bands tied around something that's not going to move, so something really stable. You take your leg, okay, through the band and bring it right up into the groin, as high as you can, you see? And then I want to feel like there's a stretch on the band, so I'm having to resist, and I want a little bit wider through the hip, and then I go into my hip flexor stretch again. And what's happening here is the band is almost tractioning and pulling my leg out, so I get a really nice opening stretch. This band is pulling, and if I want to make that harder, okay, or feel more of a stretch, I come into my hip flexor here, the band is trying to pull me, so it's a sort of a double whammy. Okay, so I'm opening up the hip into that direction, because often it's because the hip is internally rotated and really tight. Okay, so that's an added hip flexor exercise. Okay, now when we're looking at core activation, what you might find is when you're on your back in this position, if you really emphasize that imprint in the back, you really hold your back down, keep drawing in through the tummy and try and tap the floor, you might find that that improves, okay, that clicking. The minute you release your back too much and let go of your tummy, the clicking might come back. If this still doesn't help, another way to really activate and strengthen the core is to use a Swiss ball to do what I call stirs. So this is the exercise through here, really bracing the core. But if you can, you do this in a plank position. So breathe in, draw the tummy up, come up into your plank, brace the tummy, and then stir the arms. Okay, round and back. And you're trying to build up to doing this for 90 seconds to 2 minutes. Now you may need to take a break in between, but you come back up and you repeat. Okay, when you've done that exercise, you come back to your position that normally causes the clunk. Okay, and this is a nice way to feel your back. Put your hands in here, imprint your back, press, squeeze into your hands. Hold it, try that tap again. Try the exercise that gives you the clunk. Don't release away from the fingers. Try extending the leg and bring it back. Stay within the range where it doesn't clunk. To progress, opposite arm away. Okay, you progress avoiding the clunk. So if you can get rid of the clunk, do the exercise in that range. If the clunk comes back when you push it further, bring it back in again, rework the core. So we've looked at strengthening the core to take the strain off the hip flexor and stretching it. The other thing you can also do is work on strengthening the hip flexor. So a good thing to use for this is a circle of band. Okay, now you put the band across your feet, and what we're going to do, I like to do this kind of against the wall. You hold the wall and you bring the knee up and lower, and again up and lower. And then you can do both sides, even if one side feels more clunky or harder, but do the same amount on each side. So if it was my left hip was clunking, I'll do 90 seconds of these, okay, and then I'll do 90 seconds of these. That's number one. Number two, okay, is to raise your feet slightly off the floor if you can. So you might use a block or a bench, and we do the same thing. Band around the feet. So we're going to progress. You could be higher than this, your feet could be on the sofa. You lift up and you pull up, alternating. Pull, trying to pull that knee in without dropping the hip. Exhale, inhale. Again, we're looking for 90 seconds to 2 minutes of these. We want to fatigue the muscle. So get your timers on. We're strengthening the glutes as well. So that's your second hip flexor strength exercise. Your last one is to come up. The band is still across my feet. I hold my imprint. Now I push away with one leg whilst trying to keep the other leg fairly still. So I'm resisting. This is the one working. The harder the band, the harder this will be, of course. So start with fairly light resistance. You want to imprint that back, push and pull. Try not to move. So this leg doesn't move in too much. It just resists that movement. I'm maintaining the core. 90 seconds. Release. Then go back to the exercise that caused the clunk, okay? Can you do it? Imprint, find that core. Lift up. You can even push against the knees if this is the exercise. Alternate, maintaining the core. If it's a straight leg version, straighten out, press into the knee. Straighten out, press into the knee. 2 minutes of that. There's no point in doing that exercise if it's still clunking. Find a way to stop the clunk after doing those exercises and activating the core, and practice in that range. Okay, and eventually you'll get to the stage where it's not clunking. A good way to finish after that, and also if clunking doesn't cause pain, don't worry too much about it. It's not going to be causing damage. It's just uncomfortable, isn't it? That clicking deep in your hip area. And finish after you've done those hip exercises, coming up onto the forearms, lifting the tummy, and just sort of trying to stretch. You can even come all the way up if it's comfortable, and then down. Okay, and that's a nice way to finish. Brace the tummy, squeeze the glutes, and release. Okay, so hopefully that's given you a few ideas to help with any clicking or clunking hips when you're doing any of your Pilates exercises. Feel free to comment below and ask me any questions, and ask me about any other kind of niggles that you want some more advice on. Thank you.